While every effort is made to make a good and functional denture, it is sometimes hard to achieve a stable and retentive denture. This is mainly due to the jawbone constantly shrinking with age, smoking, or some systemic diseases such as diabetes or even chewing pressure on the existing denture. However, there are new advances in making dentures. One such advance is an implant-supported denture that increases the stability of the denture. This kind of dental appliance requires the placement of implants in your mouth before making the denture. Dental implants are used to replace one or more missing teeth in your mouth. Implants are made of titanium or similar materials that are well suited to human body. They are artificial replacements for teeth roots that support a restoration or a dental appliance. Before we start, it's important that you notify your dentist of your medical condition, such as whether you have any artificial joints, diabetes, or a history of heart and valve conditions. You should also inform your dentist of any medications you are currently or have previously taken, such as Redux or Fen-Phen, blood thinners, or importantly, medications that contain bisphosphonates, like Fosamax. It normally takes a few phases and several months for your dentist to complete the treatment. In the first phase, your dentist will place the implants in your jawbone. It requires 3 to 6 months for the bone to fuse to the implants. In the second phase, your dentist will place an extension or a post to extend the implants above the gum line. This process can also be performed during the first phase, depending on the technique chosen by your dentist. After your gums are healed, it is time for an impression to be made and a final restoration or appliance to be fabricated by the dental laboratory. In most cases, on your final visit, the restoration or the dental appliance is placed and adjusted to ensure proper fit and function. While every effort is made to place a successful and functioning implant, it sometimes fails. This is mainly due to lack of proper attachment between the implant and the jawbone during the bone fusing phase. Other problems such as breakage of the implants, breakage or loosening of its restoration or dental appliance, and infection of the surrounding gums are also rare possibilities. Finally, due to differences in the shapes of the jaws and the bone density, the back area of upper jaw may require an additional procedure such as a sinus lifting to increase the predictability and long-term success. If you have any additional questions, please consult your dentist.